So the other day we saw a patient who was no light perception, but my fellow said the pupil, it wasn't non-reactive, it reacted a little bit. So how can someone have a clear-cut optic neuropathy, no light perception vision, in this example on the right, but the right pupil was not non-reactive, it was just sluggish reactive. And so that finding of a sluggish pupil, despite being no light perception, could be a true finding. It could be that my fellow really detected a sluggish reaction, or it could be a false finding. That is, my fellow did not detect that finding, and it was just caused by an artifact of testing. And so let's just start with the false one. The most common cause of an inadvertent pupil reaction in someone who is a clear-cut, no light perception vision from an anterior visual pathway cause, like an optic neuropathy, is that you actually were testing the near reaction. So even though you think you're testing the light reaction, what really is happening is the patient either sees or senses that something is close to their eye, the light, and then the pupil constricts the near. However, it could be that my fellow actually measured a true sluggish reaction and they actually are truly no light perception. If they truly are no light perception, normally the pupil would be non-reactive to light, but it would react to near, and that we call an amerotic pupil. An amerotic pupil has the world's largest RAPD. It doesn't react to light, but it reacts to near because the efferent motor pathway is intact. However, you can have a true no light perception vision and the pupil is sluggish because there's this other ganglion cell, and it's called the Melanopsin ganglion cell. You need to know about this Melanopsin ganglion cell because it doesn't carry the visual fiber like the other retinal ganglion cell. It is responsible for seeing light and providing information for things like circadian rhythm and input to the non-visual parts of your brain. And so you might have a true no light perception vision eye from an anterior visual pathway lesion like optic neuropathy, and that right pupil might be sluggish and reactive from stimulation of the Melanopsin ganglion cell. This Melanopsin ganglion cell layer also is clinically important because in some patients with labor hereditary optic neuropathy, even though they have a clear-cut optic neuropathy and a central scotoma, and they're the right demographic, a young male with acute bilateral or sequential vision loss from optic neuropathy, they might have no RAPD, and some people have speculated that the Melanopsin ganglion cell is what's allowing the RAPD to be missed in these patients. And so when you're confronted with a sluggish reactive pupil in the setting of a no light perception vision in one eye only, that could be a true finding or a false finding. The most common false finding cause is that they're reacting to near. The second cause is they're not really no light perception, they actually see light perception or hand motion. But if it's a true finding and it's not an amerotic pupil, think about the Melanopsin ganglion cell.